Evening to everybody. It's 7:30 and we have a good number of attendees already joining the session, so we will start in honor of time. Welcome to the second session of the joint online training program entitled Making Cities Resilient, Developing and Implementing Local Disaster Risk Reduction Strategies to Respond to COVID-19 and to better prepare for the future. This training is jointly organized by the United Nations Office for Disaster Risk Reduction, the United Nations Office for South-South Cooperation, and the Pan American Health Organization, Regional Office for the Americas of the World Health Organization. Before we start the session and I introduce today's speaker, I would like to make a couple of housekeeping announcements for the development of this session. This session will be translated between English and Spanish. If you wish to listen to the session in Spanish, please click on the interpretation button below and select Spanish. For questions, please use the Q&A box at the bottom of your window. The session is scheduled to last for an hour, and we will have around 20 minutes to answer live questions at the end of the session. Any other questions that will not be answered or could not be answered because of time will be uploaded to the workspace where we will provide answers to the pending questions. All of the course materials are shared in the workspace. You'll have the link in the chat and also in your screens. And just a reminder that the certificate of participation will be given to those participants completing and attending 4 out of the 5 sessions of this course and at least 1 of the post-session course surveys. With that, I'd like to give the floor to Dr. Jerry Eichmans. She is the Chief of the Health Promotion and Social Determinants of Health Unit here at the Pan American Health Organization. And with that, Dr. Eichmans, the floor is yours.
Thank you very much, Carlos, colleagues from our partner UN agencies and also colleagues from all around the world. While I wait for the upload of the PowerPoint, I'd like to say that I'm very pleased and honored to be here and to be part of this very important course. I think what's happening at this point in collaboration with various partners is extremely important, very timely, and I'm really honored to be part of this. So we're going to talk today about the role of the local governments in the response to COVID-19 pandemic. And particularly, we all know, I mean, we've heard it, we live it, we're living a global crisis that started as a health crisis, but then now really has become a social crisis, an economic crisis, and even a political crisis in many places. We are happy that we can make this presentation from the point of view of Latin America, which you know has been the epicenter for several months of the outbreak. And we are getting out of it slowly. It's still not great. And we have seen very much a concentration of COVID-19 in the larger cities, and that particularly within those cities, in those that are most disadvantaged. And I think what happened here is also a huge lesson and very important for other parts of the world where this is happening at the moment. Look at India, look at South Africa, but where this also still might happen. I think there's a lot of lessons to be learned from and between regions, between cities. So again, I think it's very timely. First slide, please. So Latin America is the most urbanized region in the world. 80% of our people live in cities. And well, I didn't really mention this, but the Pan American Health Organization is the regional branch of the World Health Organization. So we are part of the WHO. We also part of what we call the Inter-American system. So we do work with countries from Canada to the south of Latin America, Chile, Argentina, and also the Caribbean. So that's the context I'm putting this in. That's what we call the Americas. So of course, COVID arrives in a already difficult socioeconomic context. And also what characterizes our region are the huge inequalities, the huge inequities that exist. We have an informal economy, meaning workers that don't have a formal employer of over 50%. Some countries like Peru, this is much higher still. So obviously this has huge implications, as we're going to see. This is a region, again, that's characterized by exclusion of many. Violence is a very important point, and this is also something that's becoming very visible now during the pandemic. And so what COVID-19 basically has done in the region, but all over the world, has magnified and intensified those pre-existing inequalities that were already with us, that are not new, but they're much more intense now. Next slide, please. So COVID-19 in cities arrives at a time, and I already said this, of where you have poverty, exclusion, inequalities, lack of opportunities, where it arrives at a time where there was already overcrowding in many places in the cities. Informal settlements have many different names: shanty towns, young villages, pueblos jóvenes. There's all kinds of names for those informal settlements, but they're all characterized by very poor conditions. Inadequate housing, it's very common. Limited access to food, and even more limited access to healthy food. We're all familiar with the food deserts, where it's difficult for inner city people to get healthy food. Water, access to water remains a huge problem. Sanitation, even worse. Green spaces where people can go walk, sustainable transportation, big problem. We also see, and I'm speaking now particularly for our region, that we had already vector-borne diseases like particularly dengue in our cities. And now, so COVID again comes on top of that huge pandemic of non-communicable diseases, and also environmental degradation, the effects of climate change. Next, please. So this is the situation where we get in February, March, COVID. And so what the world does, of course, is trying to respond, and it's responding, and it's responding very well in many cases, but a lot of challenges. So what happened is that countries started to look at the implementation of what we call the non-pharmaceutical public health measures. That's everything else to do with, not with hospital care or drugs or vaccines, but really about those public health measures that can control the pandemic. So we do that, of course, to save lives, to flatten the curve, and particularly protect our healthcare workers and protect our healthcare system from oversaturation. In Europe, this was at some point very clear that hospitals simply couldn't cope anymore. And that was a big warning for many parts of the world. And so that's why there was so much emphasis on this. So from the beginning, we had trouble as a world. I would say there was not enough testing. And so very, not enough testing, and not enough follow-up to that, not enough possibility of putting people early in quarantine when they were sick. So what we did, we came up with what the countries did with much more, I would say, aggressive or severe measures, like staying at home orders, quarantines, closing of schools and businesses, cancellation of mass gatherings, transportation in many places was reduced to a bare minimum. So very drastic measures that have impacted our lives significantly. We're going to talk a lot more about that. Also, we talked about, particularly in the beginning, about hand washing. Later on was also a recommendation of masks. And there is a very important point here at the bottom, that if we want to guarantee effectiveness of those measures, this implementation has to be possible has to for everybody. If you have 50% of the people who do all this and the other 50% for whatever reason, and we're going to look at that, cannot or cannot do this, obviously we are not going to stop the pandemic. Next one, please. So I'm going to start on the points on the right. Why is it important to focus on those groups and situations of vulnerability? We started to ask ourselves questions. Why was the implementation, or is the implementation in many places, of those non-pharmaceutical measures not as effective as we wanted it to be? How was the social, economic, cultural, political context considered when we formulated, implemented, and adapted those measures? And how did we mitigate those negative consequences of the application of the measures? And how did we take into account the heterogeneity of the needs of social groups in the implementation of the measures? And then we have to look really on how have we traditionally defined vulnerability. Very often, and this is still the case now in COVID, and I think it's an issue that's hindering us. We define vulnerability as the elderly, it's biological, and individual attributes. The elderly people, the women, the children, the indigenous populations, those with NCDs, those with obesity. Of course, those people are a much higher risk of getting severe COVID, not necessarily of getting COVID, but having consequences of COVID that are much more severe. And so when we focus on that, we forget that next point, that we need to adjust and to broaden the perspective of populations and vulnerable population to make it relevant for the response to the pandemic and its need to be helpful. And it needs to be helpful in responding. And I'm going to go into this in a bit more detail. Next, please. So when we talk about vulnerability in the context of COVID, we looked at what are the barriers that people face to implement the public health measures or the non-pharmaceutical measures. I think a traditional case that everybody knows is when you say to people, wash your hands with water and soap. That's all nice and well, and we have a whole lot of recommendations for that. But if you do not have water at home, or and the soap is a little less of a problem, but if there's no access to water in entire neighborhoods, only in a standpipe somewhere in the corner, obviously this recommendation becomes very difficult to follow. There are also unintended consequences of those public health measures. We all know about the big economic measures, companies falling, a lot of very highly visible consequences, but there are also the much smaller ones of all those people who were in the informal economy. What are they going to do? How are they going to live if they don't go out? When we put in a quarantine or when we put out a stay-at-home order, they need to go out to get their food. So these are things that need to be taken into account when we talk about vulnerability in the context of COVID. Isolation of cases at home. How do you do that when you have housing conditions, where 5 people live in a 3 by 3 meter room? How do you isolate a case there? How do you telework? I mean, we see data from ILO where they say that only about 25% of the people can telework. And of those who can do it face additional challenges where children are also home. You have to share computers, we have to share bandwidth, we have to share our phones. So there is a whole lot of issues there too. And online learning, for example, without tools such as computer or access to internet, which is not a given yet for everybody, has been challenging. So these are those barriers and unintended consequences of those public health measures, of those measures that we mentioned. So for certain groups, in certain socioeconomic conditions and in a territorial context, particularly in cities, this becomes important. So those communities that lack water and soap, those informal workers, or those workers in precarious conditions that don't have a contract, that don't have social protection. So the moment they lose their job, they have no food on the table. Those living in overcrowding, in overcrowded houses, informal settlements. The elderly, that's something we need to look at a little bit more in detail. The ones who live alone, the loneliness have also affect a lot of people, migrants, refugees, etc. And so this all, when we implement those measures that are very important, they need to be implemented. We need to do that to address, as we said earlier on, to flatten the curve, etc. So what we need to do then is to take additional measures, and many cities, and you'll see that further on in my presentation, have done that very well. We have to look at how do we provide this water and cleaning supplies, how do we get public hand washing facilities out there for people to frequently wash their hands. How do we extend and expand the social protection programs, to establish programs to support local businesses where many of the most vulnerable people are employed, to facilitate the participation of our communities and civil society to make this all happen, and also particularly to facilitate the delivery of goods, food, medication, cash, house supplies to families in need. These are just a little set. In PAHO, we have developed a document that shows all those different measures that need to accompany those public health measures. Next one, please. So those most affected, they already came out, I think, in many cases. So informal settlements, many categories of workers. Workers have been traditionally neglected quite a bit in our public health response. The occupational and the working conditions of many people are already very poor even before COVID. But now we see that particularly those that are self-employed or those with precarious contracts, self-employed seemed to be a great thing before COVID, but now it's a little bit of a different story. We see that particularly in Europe. Then people living in inadequate homes, the homeless, what do you do with those people particularly vulnerable, those in long-term care, those who are in prisons, etc. And how we have organized our households, like single parents, women head of household, has implications for how we are affected, people living alone, the elderly, those who depend on care of others. And then some very particular groups like the migrants, the refugees, those living with disabilities, indigenous population, Afro-descendant populations. In our region, the indigenous populations have suffered disproportionately. And some parts of the Amazon have very, very high rates due to many reasons, cultural, of course, but also particularly because of their poor living and housing conditions that affect them. And then the whole issue of domestic violence is huge, and we can talk a whole session about that. Next one, please. So here we go and see what does this mean, all this for the local level, be it city, be it a local, a smaller municipality. So first of all, I think it's become very clear that the local level, and particularly the city, is key to support and to strengthen the global and the national efforts to stop the pandemic. Very often our focus all goes to the national governments, which is extremely important. But the importance of this coordination between subnational in countries like Brazil or Argentina or the US, where you have states where they have a particular role, or local level, that coordination has not always been optimal. We've seen situations in our region where the mayors were crying out for information and crying out for more executive power to be able to do what they needed to do. And it really depends on the national context, how much power they have and how much money they have to do what they need to do. And why is this so important? It's because of the high diversity of context in relation to COVID-19. Of course, at national level, huge differences, but also within cities, and we all know that. The local emergencies require immediate responses. Now, people not going to the prime minister to knock at their door, they're going to the mayor and saying, hey, we have a problem here. The local level, implementing and adapting in the context of their populations, their territories, those measures. That's also become very important. What is quite different at a local level compared to national level is that there's much more intersectoral action. You know, in health, the ministries of health, of course, have played a key role in the treatment, in providing information, etc., etc. But there's other sectors, social protection, housing, environment, you name it, finance, they all had a role to play in COVID. What we've seen, we never saw before that presidents, prime ministers took at great scale the leadership of this response. And of course, then the crucial the point here is that the closeness with the community. Next, please. So what are those key areas to focus on for urban preparedness for an effective response? And this brings us back a little bit more to the resilient part that you're going to talk about in the next pieces. So first of all, we need coordinated local plans in preparation for effective responses to health risk and impact. So it's the coordination piece, the intersectoral piece. Then the risk and crisis communication and the community engagement that encourage compliance with the measures. And I think this point about encouraging compliance, I think I talked enough about that, but we cannot highlight this enough. It's not that people don't want to comply. That's very often the easy way out. People don't understand, they don't want to comply. We've seen many, many reasons why people do not comply that have nothing to do with them not wanting, but not being able to. So then there is the contextually appropriate approaches to public health measures, especially physical distancing, hand hygiene, and respiratory etiquette. We spoke about that. Maybe back one point on the communication. One of the huge challenges we're facing in public health now is what they call infodemic. A lot of fake news spread from presidents to anybody who has some kind of conspiracy theory. It's huge, and it's very, very difficult to respond to all that, but it's necessary. Then the fourth point is consider those diverse social cultural interactions with health issues, norms, perceptions in subpopulations that may influence the local take-up and effectiveness of public health measures. And the point, of course, the access to healthcare services for COVID and the continuation of essential services. And of course, those people that we talked about are also the ones that have most difficulty with accessing healthcare. These are also the ones who don't have a health insurance, who cannot afford to go just to see a doctor and to pay for the test if it's not provided free. So, you know, we see that the issues accumulate. Next, please. So PAHO has developed a plan of action that was adopted by all ministers of health based for disaster risk reduction, which is based on the Sendai framework for disaster risk reduction. So our plan goes from 2016 to 2021 and has been very useful in this approach in our region. So it has 4 basic pillars. Or strategic lines of action. One has to do with recognizing the disaster risk in the health sector. The other one has to do with governance, the governance of disaster risk management in the health sector. The third one has to do with making our hospitals safe and smart. And this is a particularly important point if we were now in the middle of the hurricane season in this region. You have seen, I don't know any of you have seen the number of hurricanes that's lining up in the Atlantic is higher than ever in history, in reported history. So we've been until now, I'm not going to say much about that, not to tempt fate, of course, but the hurricanes have passed, not so much over the Caribbean, more. Well, the US has been affected quite a bit, actually now in a emergency mode. But so those safe and smart hospitals need to be resilient for anything, for COVID, but also for a hurricane and for other things. And then the health sector capacity for emergency and disaster preparedness, response and recovery. So you see that this is a plan very much focused on the health sector. We have already talked about the need that the health sector interacts with other sectors, and this has become extremely clear in this COVID pandemic. We have to look at multi-hazard and also those vulnerabilities that we have been talking about. Next one, please. So I'm going to present to you some case studies. I'm going to present 3 cities from Latin America that have really done a very interesting job. And unfortunately, it's too difficult or too early to say it's great, it's all done, but they've done better than most. And I think that's important. The lessons learned are still coming in. We're still learning while we're doing. So I'm going to present Bogota, Mexico City, and Buenos Aires. So first one, please. Bogota. So they were very early. They took early measures to confront and mitigate COVID, even before the national government. And they made the reference case in Colombia and also in Latin America. There are actually several cities in Colombia that have done a very, very good job, but Bogota was particularly early. So what they did, they identified and they mapped how and where the pandemic would strike, especially those in situations of vulnerability, like we've said. So they identified gaps, they mapped the social environmental conditions to focus their interventions and their support. So when they implemented the public health measures, they accompanied that with other measures that we have been talking about, like social protection, giving people food program. There's something very basic. You think, okay, you close a school, kids cannot go to school, there's a problem. But we have to think about how many people in our region depends on the children receiving nutrition, food in schools. So the moment you close a school, you even have that on top of all the other problems. So these are very, very complex problems. So they looked at that and they took that into account. They used their pre-existing social mechanisms, etc. And then they used some strategies. Some were already existing, but others are new, to allow the reduction of the speed of the transmission. They identified special care zones. I'm going to show a map, and they did that in quite a level of detail using data in a very sophisticated manner. They call them zonas de cuidados especiales, special care zones. Yeah. So they were fierce, they were strong on the mandatory isolation. It was not voluntary like in many other places. They used quarantine of localities, not just, not the entire city necessarily, but local areas that need to be quarantined. They did massive testing the moment tests became available in areas with high transmission rates, and they followed up with the contacts of those identified cases. Huge, extremely important. Then they had some pre-existing strategies. There's one called Pico e Género that has to do with people that men and women can go on the street for different things at different times. It's a very interesting one. I think it's one of the few countries who do that. It has some interesting co-benefits. We can talk long about that. But what it did do, it reduced, you can say, okay, on Monday, the man can go to the super. On Tuesday, the women can go at that time. So you spread the people going out. So that was Pico e Género, and the same was done, Pico y Placa, that had to do with more with circulation. Where and it's also something that happens a lot in countries that and cities that try to curb contamination, where you say certain cars can only leave certain times of the day. So they use those pre-existing models to reduce circulation, to reduce very close contact between people and gatherings of many. One of the things that has been very important in our cities is the markets, public markets. And this is not to be underestimated because many poor people rely on markets to get their supplies. They cannot afford the supermarket prices, so they go to the markets, and they go often because they don't have a fridge to keep their food in. There was at some point a question in, I think it was in Peru, that they said, why are those people going so often to the market? Well, that was pretty simple, because when they didn't have a fridge to keep their food. So these are some things that we discovered. Again, COVID has learned and taught us many, many lessons. And so these things have become very important also in those strategies. Next, please. So these are those special care zones. When you can see, this is a map, Ciudad Bolivar. This is a part of Bogota. They looked at the different neighborhoods. So this total neighborhood has about 200,000 people, and they went into a lot of detail, and you can see there the red, the yellow, the orange, the yellow, and the greens. So they focused their actions on those municipalities in red and in orange, and that has given them a whole lot of buy-in and a lot of people complying and being able to comply with the measures, and thus curbing the pandemic. Next one, please. So there's other things that Bogota did, called tactical urbanism, that was used to reduce the spread. So these are interventions that not only reduce the COVID spread, but also have positive effects on the risk factors that underlie those conditions for severe COVID. For example, overweight. We all know that people who are overweight and people who have diabetes and some other chronic conditions have a higher risk of getting severe COVID. Not necessarily of getting COVID, but when they get it, they get more sick. So they built temporary bike lanes to decongest public transportation to prevent the spread of COVID. And we all know that cycling is now considered one of the most effective and most safe alternatives to move into this new normality. We're going to talk a little bit about that, since it avoids close contact and exposure to crowding. Plus, it's very healthy. Of course, I mean, there's cities that are a little bit more apt to bicycle use. I would not necessarily recommend it in La Paz in Bolivia, where you are at altitude and you have a lot of hills. I'm from the Netherlands, so I'm always pro bike, but there's a lot of win-wins there. So you have air pollution being tackled, climate change would really benefit if we shifted from our normal transportation, individual car use, etc., to a more sustainable use of transportation, including bicycles, but it also helps us with curbing those chronic diseases. So on a permanent bike network of the city of already 550 kilometers, another 76 were added as temporary bike lanes. And who knows, maybe they stay, I hope so. So next one, please. This shows a picture of the already existing bike lanes and additional ones that were built. Now, I do need to say something about bike lanes, because although this is absolutely important for many people in the city, exactly those who are most vulnerable, who live in very dangerous areas, who need to go out very early to be on time to their work, those essential workers, the cleaners, not only the health workers. We talk a lot about our nurses and our doctors, which were absolutely essential, but a lot of other people that have been continuing doing their jobs. Who's been collecting our garbage? These are people who live in those very neglected areas, and they don't necessarily can come to work on a bike. So these are things, even, with the greatest solutions, you always have to take into account those who are most vulnerable. Next one, please. So Mexico City. They had a program, again, based on what was there in the past. So it's very difficult to start something from scratch when you're in the middle of a crisis. So again, Mexico City used that. So they had a program, Salud en tu Vida, Health in Your Life, that started in 2019, that was launched as a territorial community approach based on primary healthcare to proactively confront COVID-19. But this was based on something that was already there in another name, under another government. It's not new to Mexico City, but it has, of course, been revamped and been strengthened. So the health brigades created in 2019 included doctors, nurses, social workers, community workers for the detection, the protection, and the support of COVID-19 patients. And those brigades, they were initially designed before COVID, let's say, to support people with reduced mobility or in situation of vulnerability. And so since COVID, they use them, they repurpose them. They have become key actors in the fight against the pandemic. And those 5,000 brigade members deployed in the city has carried out tests at the homes of people that are particularly vulnerable to the virus. And again, these are the people who have a higher risk of getting very sick, like the elderly, like the people with disability, etc. And they gave them medical kits to measure oxygen, they gave them prevention measures, health promotion messages, etc. So a very comprehensive approach, going to the people and not waiting for the people to come to the health center. Even in our most sophisticated cities, I was in the Netherlands to visit my family not too long ago, which I'm very happy I could do. But I see that it's assumed that people can come with a car to do the testing. And that's not necessarily the case. Even my parents don't have a car, you know? So these are things that we need to think about that. How do we reach those people who cannot necessarily come to us, but need to be addressed? So up to August, 60,000 homes have been visited, and this is continuing and growing. Next one, please. So the other thing, what this Health in Your Life program does is identify early warning signs in suspected cases of COVID in the community so that they can be referred to specialized hospitals. They use SMS and systems with about 200 doctors and 1,800 trained operators to guide people that have symptoms to seek information on their risk factors by telephone. So that was also very successful. They have increased the testing capacity to break the chain of transmission. And they have also worked with those people who have they had higher risk of developing the severe forms. We already mentioned that: hypertension, diabetes, obesity, cancer, and other conditions. And they mobilized communities by carrying out community campaigns to promote healthy behaviors and to prevent COVID infection. So these are some of the things that happened there. Next one, please. So we are now moving to Buenos Aires, to Argentina, to the south of our continent. And I'm going to show you there two strategies. First of all, they worked on informal settlements and intervention on formal settlements through a participatory process. So the City Housing Institute started to strengthen community resilience in what they call a VIA 20 in Lugano in the neighborhood. So the VIAs are very small neighborhoods to a set of interventions to help meet the community food, health, social, economic needs. It did encourage the participation of the community in the neighborhood groups, which meant that these measures were very rapidly adopted with the community ready to participate and getting involved in COVID-19. So this community participation was absolutely essential. So they covered 5 areas: food security, big thing, we're not going to talk much about that, very important in terms of resilience; health, urban hygiene, urban health, emergencies, and communication. The results have been lower numbers of cases, and they compare that to other neighborhoods of confirmed cases and of deaths, and high level of community willingness to participate in all those social distancing measures. So again, we talk about willingness, but again, it's also the community possibility to participate in those measures. Next one, please. The other example of Buenos Aires is also very interesting and has to do with aging populations and emotional and psychological support. So to confront COVID, Buenos Aires also implemented something called mayores cuidados. You have several ways of translating that. I think that's probably the trick. It could be greater care, but it could also be older people that are taken care of, which focuses on the elderly and the people with disabilities that are living alone. So it's a volunteer program that's based on emotional, psychological support, launched in the middle of this pandemic by the city to support those specific groups. People helping people and building social territorial cohesion in a crisis, another very important concept here. So Greater Care assists by phone, but they're also, calling people who are lonely, but they help make the purchases in shops, in pharmacies, the people who cannot go out. They pay for the bills, they walk the pets, but they also use Zoom, WhatsApp, and other digital applications to communicate between the elderly or the people who cannot do it on their own, with their families, with their relatives, with their friends. And this initiative has already a lot of volunteers, but it's aiming to get 50,000 residents willing and participating in maintaining the strong bond with the city's elderly and people with disabilities who require assistance. Next one, please. Getting to the end of my presentation. Resources for cities. So next one. WHO has prepared some very interesting resources. You will have this presentation, so you see the links to that at the end of the document of the PowerPoint. So one is practical actions in cities to strengthen preparedness for COVID pandemic and beyond, and also strengthening preparedness for COVID-19 in cities and urban settings. Having said that, WHO and PAHO have brought out hundreds of documents that, about particular topics, but these are the ones that vary, and you will all find them all on the website of WHO and PAHO, if you want them in Spanish or in other languages, but these are the ones specifically for cities. Next one, please. There's also a simulation tool developed by WHO, Urban COVID-19 SIMEX, to identify critical issues in urban environments as the pandemic develops into established infectious diseases that may have periods of increased spread and numbers of people affected. And so this package consists of different elements: PowerPoint, a participant guide, and there's a set of reference documents, a technical guidance on COVID that's linked to that. So that you can also find in the WHO website. Very, very useful tool. Next one, please. So some key messages, just basically summary. Yeah, thank you. So the role of the local government is key. I don't have to convince you, we're all here for a reason, but the coordination between local and national government is crucial before, during, and also after the emergencies. This needs to be a lesson that we take away. Intersectoral action to a health and all policies approach, putting health and well-being in the center, addressing the social determinants of health is essential. 3, populations have faced barriers to implementing and also consequences from the implementation of those public health measures. Not everybody has had the same opportunities. Now this hinders the pandemic. It's not just bad for those people that have faced those consequences, but it's also bad for the entire country because we're not, overcoming the pandemic as we could if we would have worked differently. Local socioeconomic and cultural contexts need to be taken into account when implementing measures, and mitigating measures need to be put in place immediately, even before or when we start the public health measures. And we've seen as some of the examples of cities that have been most successful have taken those elements into account. Next. So the community participation is essential, and it's not just us telling the community what to do, it's really about participation. Cities and urban settlements should document, learn, share, and adapt their COVID-19 experiences, including taking proactive steps to collect evidence and advocate for financing of sustainable capacity. This is crucial. This is not going to be our last crisis, unfortunately. So if we don't learn now, we're going to make the same mistakes. We also learned that we did not invest enough in public health. Hopefully this mistake will be also learned from. So the next one is the conduction of the last key message is formal after action reviews to ensure that progress in emergency preparedness made during the current outbreak confers benefits to a wider health system and helps to inform and build better preparedness for reducing the risk and impacts of future events. Next, please. And this is my last slide. So the new normal, we talk a lot about the new normal, like it's like it's almost automatically going to be a better normal. But I think we really need to think about how we want this new normal to be. Do we still want to talk about all these exclusions and you know, I don't think so. I think we need to think about, you know, what is the opportunity, you know, despite all the suffering, despite the crisis that this COVID brings to us. It does require profound changes in our societies. We will always have issues if we have the haves and the have-nots excluded, those who cannot participate in society, cannot participate in the response. We have to focus more on social justice and inclusion. And the cities are at the heart of this innovation that's needed. And they bring the creative solutions. It's the young people in our cities. It's all of you who can help and who will and who are doing this while we're going. And we need to learn. We need to learn. This is an imperative, our current situation for a better future, but we also need to plan for a better future. Thank you very much. The last slide has some points, resources that you can use later, but I really want to thank you for this opportunity. I'm sorry I was a few minutes over time. Thank you.
Jerry, thank you very much for that very enlightening presentation, and let me thank all of the attendees for their participation and the wider range of questions we have been receiving in the Q&A box for the past half hour, 40 minutes. Jerry, just so you know, we've received over 50 questions, and we still have around 20 questions open to be answered. I've tried to group them at an initial stage in two that we can tackle at first, and then keep answering those questions depending on time. So the first two questions, and then we'll go on to more. First, what would be the interface between local governments and the support that PAHO WHO can provide those local governments, either training, logistics, etc.? So could you please elaborate on that? And then the question that we received before that I know you touched upon a bit on your presentation, but there's still more questions in the box now regarding to people in situations of vulnerability. How is that being addressed? How can PAHO support that effort? And then how can that be supported as well from the local level? Over to you.
Thank you. Thank you. Some great questions. So first, the interface between WHO and PAHO as part of that and local governments. This is a very important question because, as you know, WHO and PAHO, our constituents, our members, our member states, our countries, our ministers of health. So traditionally, for a very long time, we have mainly worked with ministers of health. This has been changing over the last decades, I would say. But even when we were doing urban health, sometimes it was urban health, not necessarily with the cities. So we have taken a very proactive approach, and we say, look, no, we do need to work with cities, but then we have to work with them in networks, because you can imagine that an organization like PAHO or WHO does not have the human resources, the capacity to work with every city or municipality individually. So we have worked with networks. There's the global networks. We work, there are actually already many existing networks like Bloomberg, Resilient Cities, C40, et cetera, that, and we had ourselves, we work with healthy cities networks or healthy municipality networks. So what we do with them, it is exactly that, training. We are actually at the moment carrying out a questionnaire asking, okay, what are your most urgent needs at this point of the pandemic? This is for our cities in Latin America. We have earlier on identified with the mayors what their needs were, but now we are at another phase of the pandemic, so we're looking again at that. So it's training, it's tools, but that interface is extremely important. And for us, we really want to, and we have recognized, and our executive management, the high level of the organization, have recognized the importance of working with cities directly, with the governments of cities, and have those cities also play a role in supporting others. I think that is also that's a mechanism that we still need to explore much more. There's a lot of exchange already going on, but if you have a city like Mexico City or Bogota, etc., despite political different colors, which is of course a reality in our countries, there should be a way of having those like reference cities that can support others in networks at national level. So these are some of the things we are promoting at country level with our WHO PAHO offices at country level. But from a regional and a global perspective, we're really trying to take a very high level approach and also to facilitate this exchange, this interaction between national governments and local governments. We do play a role in that. It's not always as it should be, and we have managed in some occasions to broker a little bit that role. So the next question has to do with populations in situation of vulnerability. Yeah, I think honestly this is the crunch of the matter. We all know what to do to curb the pandemic. However, not everybody can do it. So I think what we did, and I didn't go into too much detail there, but PAHO formed a working group on vulnerable populations related to the implementation of the measures. And we developed this document. It's a guide. It's taken a while because it's quite complex and quite particularly complex and deep, that shows national, but particularly local governments, like if you implement a measure, like, you know, close a school, these are the things that you need to take into account in order to make sure that it will work. And these vary from, you know, access to internet to, as I said, the provision of food, to ensuring that the kids, the gap in learning doesn't get too big, and that those kids who do not have computers or phones have access to some. This is just an example. But so this guide will, and we are working also with WHO on that, but it's really about helping governments to identify and to act at the same time. Not only say, okay, we go in quarantine, because this time is not over yet. We are releasing, we are opening up, but there will be, and we're seeing this again in Europe and other places in Asia, where after a while the cases are coming back. Now, can we be more intelligent on how to implement those measures, avoiding those total lockdowns and ensuring that those who need to be supported are supported. And these are not just big economic benefit packages. These are important, but we have to really learn how to target the most vulnerable, and we can really learn from our cities in doing so. Over.
Excellent. Thank you very much. Questions keep coming in volumetric levels. I see another pattern here in some of the questions, which is this debate between opening up economy and of course the public health non-pharmaceutical measures, the tourism sector. What would be the take on that for our attendees?
Yeah, and this is a very, very important question. And I think it's almost a false dichotomy. You know, you cannot have a healthy economy or an economy prosperous and running when you have a huge public health crisis. So you need to work in tandem. And that's, so we need to really make sure that we have the intelligence and the capacities to work at a more precise level. You know, you cannot just open a whole country or close a whole country. We need to see, okay, where are the pockets? Where is the community transmission? Where do we need to focus on? And that's, we have learned, we are not in the same situation as in March and in April where we couldn't do that. But I think what we've seen when we opened too quick, people have been home for 2-3 months and all our gains go down the drain, and nobody wants that because we are not there yet. And it's going to take a while. We are not that optimistic about having a vaccine this year or even early next year. So we are going to have to live with this virus for a while, and we'll have to find ways of slowly opening, really do this in an intelligent way, with testing, with contact tracing, with people in quarantine, really staying home when they have symptoms, and really staying home when they have been in touch with somebody, really staying home. I'm in quarantine at the moment. You know, when I came back from Europe, you have to. I mean, this is a responsibility that we all need to take. So people and the governments need to work with people to make this possible. But the economic consequences are huge. We cannot deny that. I mean, we're seeing in this region about a huge increase in poverty. We see this increase in inequalities. We have seen many companies that have filed for bankruptcy. Some maybe haven't done it yet, but maybe will still come when they cannot fully open, etc. But please, let's not do this independently. Let's work in tandem between the opening that's needed. People need to have a living to be able to, you know, to eat, etc. But also let's do that, not without taking into account all the correct public health measures, because it will backfire. And so that's the main thing. And we've never, I think, have seen so much interest in that. There's a report that came out from CEPAL and PAHO that particularly looks at this. What's the balance? And that's what we need to look for a balance. It's not this one or the other one. We cannot have public health without an economy, and we cannot have an economy without public health.
Excellent. And trying to wrap up now, I see, I'll try to also group this and see how we can address the variety of questions and also comments that I see coming up in the chat is, first, where can local governments go for guidance and tools and strategies? I see that you've put a few of the resources on your slide, but it would be good to develop on that. And then specifically, I was asked, in relation to your key messages, specifically point 7, how can they document, learn, and share and adapt their experiences in terms of COVID-19?
Okay, yeah, great, thank you. So we'll start with the last one. WHO actually has a template they developed on how to document good experiences. I think actually we still have to do better on that. We have developed a set of criteria for this region that look at, you know, it has to have, of course, a certain levels of success. Of course, you also want to learn from things that didn't work, but you want to see that it worked. You want to see that it's evidence-based. You want to see that there was some community participation, there was some intersectoral action in this measure. So I would say WHO's, you can document in tandem with your local WHO office. I think this is going to be something that's going to be more and more encouraged. So what we can do from our region, we can share with our offices the template that we think can be used, and then so you can contact them and work with them on documenting that. Now for WHO, there is also an office there that is doing that. We can come back to you in the chat exactly how that, or in the comments, how exactly you can best do that. I think the template will help, but there have to be better mechanisms to capture that. I totally agree with that. And then the tools and the strategies, yes, there are some that you can find in WHO. There are many other agencies who also have developed tools and strategies. You will learn a lot more about when this is coming. But many of the documents, although they were not prepared specifically for cities, are like the reopening of schools, just to give an example, or how to manage well, the hospitals, etc., they have a very important message also for the local governments. I think it looks specifically at the ones that were developed for local governments. There will be coming many more, because this is something that's really now in a high level a spiral, let's say. But the ones that are there already, please use them.
Excellent. Thank you. Thank you very much for, again, that presentation and for the answer to those questions. We are a few seconds short of getting to the end of the planned hour of this session. And with that, I'd like to thank you again and thank all the attendees for joining this session. A few housekeeping announcements before closing. Please remember to fill in the post-session survey that has been posted in the chat box and will be sent to you by email as well. And note that the next session taking place on 22nd September will deal on applying the assessment diagnosis tool, disaster resilience scorecard for cities and public health system resilience. I am sure you will all be very interested in attending that session. And with that, I think we bring this to a close. Have a very good morning, good afternoon, and good evening to you all.
Thank you. Bye-bye.